Welcome to this interview.
Thank you.
My name is Anouk de Vre. I'm 25 years old and I live in Zandam. And I'm a third year student of skin therapy at the Hague University, at The Hague.
Yeah.
And in this school block, we're having an international global health course to learn more about the global health problems and differences. In this interview, I'm going to ask you a few questions about perceptions and experiences in Dutch health care, and also compare this to the differences of the land where you came from.
Yeah.
And I will also ask you about education and culture.
Okay, perfect.
So first of all, I would like to ask you if you want to give an introduction of yourself.
Yes.
So who are you? What's your profession?
Yes.
Where have you lived before, and how many years you lived here?
Yeah, it's my pleasure. So my name is Denise. I'm a dentist. I finished my dental graduation in Portugal. That's where I come from. I lived my whole life in Portugal, and I decided to move here to the Netherlands not so long ago. Mm-hmm. I work with children. I'm a pediatric dentist, and I just love what I do, actually. So. I'm looking forward to the interview.
Okay. And what was the main reason you left Portugal for Holland?
Yes, so Portugal is like a lovely country. I love everything about it. I love the weather, the people, the food, everything's amazing. The only problem is with work. It's a bit difficult to find work in my line of profession. Mm-hmm. So I decided to move to another country. I thought maybe I would move to England because when I finished in 2012, all of my colleagues, a lot of my colleagues, went to London.
Okay.
But when I graduated, it was also a bit, overpopulated with dentists. And so I decided to change my mind. And because my grandmother, she lives here for almost 40 years now.
Okay.
And I used to come here on vacation, and I thought, I liked the country actually. I could only see it for a few weeks. Mm-hmm. And I decided to move here to try my luck as a dentist as well.
Okay. And it was easier to find here a job?
Yes, it was really easy actually. It's really funny because I came here to do in the summer vacation, and I wanted to do a course for Dutch language because I had a plan to come here, so I thought I will do a course first, an intensive summer course.
To learn Dutch.
Yes, to learn Dutch. Yeah. And what happened is I sent my curriculum, my resume to a few dental practices, and before my course finished. That was a 3-week course. I already had a job.
Oh wow!
So I was really happy.
Yes,
it was really quick, so that's what happened. Yeah.
Okay.
Yeah.
Okay. And what is the biggest difference between Portugal and Holland?
Yeah. In terms of work.
Yeah.
I think that. There's a better quality of work here. Also, the minimum wage loan here it's a lot higher than it's almost 3 times higher than in Portugal. Yes, in Portugal the minimum wage is around 500 euros, around that.
Okay.
Yes, it's really a short. It's really a small amount.
Is it because there are a lot of dentists there, or?
Yes, yes. The thing is, the problem is because dental course is like a higher, superior course. Mm-hmm. There are a lot of people that are receiving the same minimum wage for the lower professions.
Yeah.
So yes, I have a few colleagues that are working there. They do receive the minimum wage, which for a dentist it's a bit low because you've studied all those years and you expect a little bit more. And in Portugal it's at this moment a little bit difficult to find a good, well-paid job as a dentist. So those are actually the main differences. And
in a cultural way?
Yes, in a cultural way, it's also really different. We have our weather is a lot better than yours. Yes, I was there for the summer, for the Christmas. I'm sorry, and for Christmas it was like 17 degrees. It was really sunny and it was not cold at all. Yes,
it's weather.
Yes, it's well today it's cold. It looks like it's good, but it's cold.
Yeah, it's very cold.
And yes, people are also are really nice, but here as well. And what can I say more? Food is different, of course. I'm really used to Portuguese food.
Yeah.
Yes, but I like it here as well. So I guess it doesn't matter much to me. The cultural differences don't matter that much.
No. All right. And what do you think of the Dutch insurance system, of the healthcare system?
Yes. I think the system it's really well conceived. It's really well organized. If you compare it with the insurance in Portugal, for instance, we don't have, or we're not used to work with insurances actually, because the healthcare system is free for everybody. The only thing is, then you have a lot of wait lists. Then the wait lists are really big, actually, because everything is for free. So if you want to do it in the public health insurance, then you have to go for the wait list.
Yeah.
And sometimes it can take about 3 years before you get your treatment, but it will be for free. So, and if you can wait 3 years, it means that it's also not urgent, because of course the urgent treatments have priority, so they will be taken before the other treatments. But still, it can take about 3 years before you get your treatment in Portugal.
Oh, wow.
And that's the difference, that it is free for people.
And first aid?
Yes, first aid is also free. I think all over the world it's free. Only the first aid help in Portugal as well, so it's also for free. And of course, some people don't want to wait, so they decide, and if they have the money to do it, then they can be treated in the private system. Yes. Yeah. Then it will cost them money, of course, but they will be seen much earlier than. Yes.
Okay.
Yeah. Oh.
Okay. Do you have experiences in the Dutch healthcare?
Yes.
With doctors or?
Yes, I've been to the doctor here a few times, not much, just for regular control. So,
okay. Yes. And how did you experience your visit?
Yes, it was okay. A really nice doctor. What I really think it's well, you use a lot the general doctor, the GEs, because in Portugal, people, when they have something, they just go to the hospital. And that's why the hospitals are really full with people that I'm not saying they don't have anything, but they don't have such a serious problem that has to be solved in the hospital. And here, I think that's a really good thing. People go to their doctor, and then if something has to be done, if it's something serious, then they send them to the hospital. Yeah. That's how I think it should be. Yeah. And in Portugal, people are just used to go to the hospital for everything. So all the hospitals are full with people that don't have anything serious or not serious, like a flu or a stomach ache or something that the general practitioner can solve, and they don't need the help of the specialists that are in the hospital. So. Okay. Yes, if you compare it in that way, I think the system in Holland works a lot better than in Portugal. Yeah.
Okay, I understand. And what do you expect from the Dutch healthcare?
Yeah.
Is there something you miss here?
No, I don't think so, because actually, if you have a problem, you can go to see your doctor, and he will send you to wherever you have to be. The system here, I hear a lot of people complaining about the insurances, that they are too expensive.
Yeah.
but on the other way, I think they also help people that don't have that much money. They also help with a little part of the insurance.
Yeah.
So I think that would be the only thing about the insurance system of the health system in Holland. But I don't have any experience with. Fortunately, nothing has happened that I had to rely on the system. But for me, as a healthy citizen, I think everything is okay. It's perfect.
Okay. And what do you think about education in Holland? Like dentist education?
Yes.
Is there a big difference compared to? You already said something like that. But.
No, but in Portugal, our course, our education lasts for 5 years. When I started my graduation, because everything in the European Union was. They were put equal, so that all the courses in the European Union would have the equivalences, so that they would be the same. So before my time, I started in 2000. I must not lie. I was not that long ago, but I think 2007 when I started.
In Portugal. Right?
In Portugal, yes, in Portugal. When I started there, I had. The course was already 5 years. The year before me, they had a 6-year education course as well. The same as here in Holland. Yeah. So here you still have a 6-year course at the university course, yes. So that's one of the main differences. And the other difference is actually when you finish your graduation in Portugal, you are not obligated to go on an internship or something. So I don't know if here you have to do something, a stage or something.
Yeah, I think so. Yeah.
Yes. Well, in Portugal you can start working right away.
In your own country?
Yes. Abroad as well.
Okay.
What I had to do, so when I finished my graduation, because I was a student from the European Union, what happened was I could just apply for equivalences. So this means I had to send a few documents proving that I finished my graduation in Portugal.
Yes.
And I received 3 months later, I received a document that allowed me to work here in the Netherlands as a dentist. That is the big register that every person here in the health insurance must have. So when I got the papers, I knew I could start working here with no problem actually. So
and that was in 3 weeks.
Yes, I received it in about 3 weeks because I couldn't speak any Dutch then because I sent the papers all in English and they were refused a lot of times. Well, not refused, but they said that that document should be in Dutch.
In Dutch, yeah.
And that's I find it quite hard because for somebody that's still in another country and has no contact.
You have to start somewhere.
Yes. So it was a bit difficult, but they did accept them. But they referenced that they wanted the documents in their official language, which is Dutch. But I think personally, and because I've been there, it's impossible because if you want to start. You can only work here if you have that license. And to apply to the license, I was still in Portugal, so I had no contact with the Dutch language, so it was a bit difficult.
Okay.
But everything worked out just fine. Yes.
Now I would like to go deeper into the dental care because you're a dentist.
Yes.
Is in Holland the same like in Portugal when you look at the insurance for the dental care?
Yeah.
For not children, but adults?
Yes.
You think that's different?
Yes. There's a little difference. Here you have the option to have insurances. So if you are insured for the dentist, you get a certain amount that you can use in your dental with your dentist. In Portugal, that exists as well, but not many people do that because it's expensive. Also to have the insurance. So you can imagine if they cannot afford the insurance, they can also not afford the dentist.
No.
So unfortunately, going to the dentist in Portugal is considered a luxury. So not everybody goes to the dentist, yes.
Okay.
And what really breaks my heart is that also for children, and because I work with children here, I couldn't imagine having to work with children somewhere where the healthcare had to be paid for children by the parents that don't have the ability to do it.
Yeah.
Because then the treatment wouldn't be done because they cannot afford it.
Yeah.
And it's really sad to see a child in pain and not being able to do anything.
Yeah.
Yeah. So it's I'm really happy that I work here, because if you compare that situation here, when you can provide all the care that a child needs without having to worry about if the parents can pay it or not. So you can totally focus on the children and do what's best for them. So in Portugal there's not a chance to do that, and unfortunately, yes.
Yeah. You said you work with children in the age of. You work with children.
Yes.
Sorry. In Holland, children are until the age of 18. They are assured for dental care.
Yes.
And that's not in Portugal.
No, that's not.
Do you think it's gonna come someday there?
Yes, they are now busy with a few things. They have this thing called the dental check.
Yeah.
So for children and for pregnant women, and I must say that I really don't know for sure how it works, but because I left them the country and when they installed these measurements, but I must say that they have these dental checks that allows, it's a check that every children get at home, and allows them to go for a checkup, for instance. So there's a certain amount, of course you cannot do everything, but allows them maybe to have something done, not much. So they have a few dental checks a year. And this is, I think, a way of...
That's insured, or?
Yes, that is paid by the government. And I think it's a way of starting to get into this free care for children.
Yeah.
So yes, it can't be done in one time. So there has to be little steps. And I hope this is one of the little steps that my country is taking to take health insurance to another level. With children, but also with grown-ups.
Yeah.
So
and maybe it's like in the schools.
Yes.
Because
they don't have. We don't. Not that I know of. When I went to school there, when I was in the university, we had we had to go to a few schools. We would do it for free, of course, and then we would do regular
for practicing.
Yes, for just for purposes of the study, and we would make the checkups at school with the permission of the parents and the teachers. We would teach them how to brush. So for the whole morning, a lot of students were there with the children. Yeah, it was really nice. And then if we saw that the child needed some treatment, we would give them a little card saying that they could make an appointment at our university, and we would treat them. But as
for free?
No, that is the thing. So as you can imagine, not a lot of children came because not a lot of them could pay. We could see a few, but not. It's far from desired.
Yeah, that's very difficult.
It is.
Have you been to the dentist yourself in the Netherlands?
Yes, I have. I have for a treatment, yes.
And are you just going here, or?
No, I have a colleague of mine, and we treat each other, which is really funny. Every time I need something, I just call him, and I can stop by his practice. And if he needs something, he just stops by, and it's just...
Okay. And your experiences of the visit was...
Yes, it was okay. I've also been to another practice before I met my friend, my colleague friend that works here, and it was okay. So it was a practice in The Hague, and I liked it very much. They were really professional about what they were saying. I told them I was a dentist, so they showed me everything also. I was satisfied.
What do you expect from the Dutch dental care?
Actually, above all, I expect it to be a service that takes good care of people. To attend the service that attends to their needs. Yes, I think that's the most important thing for people, that they feel a service where they feel safe and good taken care of, actually. So, yeah, those are my expectations.
And is there anything you like to see different?
Well, from what I've experienced until now, everything is according to what it should be. So every time I need an appointment, what I do, I need something, I make an appointment with my doctor, he sees me, and maybe I would like to see the insurances. I know that health system, healthcare is expensive, so yes, we do have to pay for it. But I hope we can have like more quality. With a payable price, let's put it like this, for people because I think most of all that health care is something that everybody should have, despite of whether you have the money or not. It's a bit unfair to say that just because you have money you will have your health good taken care of than if you don't. And that's what I like actually about the health system in Portugal, because everybody can have it. But actually my country is in a crisis situation, so maybe that's what led to it. I don't know. Of course there are limits. Yes, of course there are limits and people have to pay, but I hope it becomes affordable for everybody.
Yeah. Yes. Okay. Is there a difference in treatment comparing to Portugal?
Well,
to Holland.
To Holland, yes. Yeah. Well, in the dental care system, I think that there's the treatments are all the same. The thing is, it's in Portugal. What we do also a lot, we see is depending, of course, where you are. But there are people that go more for something like extractions to take your teeth out, or to for cleaning, or only checkup. And actually, there are people that need dentures because they, for some reason, they lost their teeth. But that's
a brace, or
yes, braces or dentures or implants or those kind of more expensive treatments. And it's hard to get them because they are expensive and people don't get it. So we don't practice that as much as we would like to, because people can't pay it. So actually it's we take teeth out and then we...
So when you came to Holland, you will get it a lot. And there...
Well, yes.
You practice a lot?
Depending on where you are, actually. Because if you work in certain areas of Holland where the incomes are lower, well, the reality is the same. Because it's still expensive to get those kinds of treatments. Yes, and it is here. People can't pay it more because of the insurances.
Yeah, it helps extra people. Insurance.
Yes, it helps people to get those kind of treatments. So if you compare it with Portugal, there we don't have insurances, so people have to pay everything from their own pocket, and sometimes, unfortunately, they don't have it, and they have other priorities, and that they consider to be more important than the dentist. And that's where it's actually wrong, because it shouldn't be a choice, because it's your health. So everything starts also in your mouth. So if you can't eat, or if you can't smile, if you can't talk, then it's gonna it's gonna affect your whole body, actually. Because also with the way you communicate with people, if you can't laugh, if you can't eat properly, then you will be socially you won't feel as much at ease in a social environment, so yes, it has an influence.
And when you get a patient like that, and what will you do then?
Yes. Well, actually here I've had also here in this practice a few months ago, some refugees family with children, and they weren't insured actually. So
here in the Netherlands.
Here in the Netherlands,
yeah?
yes, because of course all the complicated situation that it involves. They didn't have the insurance, but they had. It hurts and it was painful.
Yeah.
Yes, so I just treated them, because above all, if somebody, and that's a rule that everybody in the health system has, if somebody has pain, they have to be treated, either if they have the money or not. So yes, that's actually then I helped them.
And do they use the same equipment or materials in Portugal?
Well, yes, actually, it's in the science world, everything is always developing. So every day there's a new material to use, something new to do, and a new technique to apply. And yes, in Portugal, actually they exist, the techniques, and yes, we kind of use the same materials and techniques. That's a bit universal, only because sometimes some treatments are more difficult to do than others because of the monetary question. What we do is we don't practice them that much, or I didn't that much. Of course, I was also a young dentist, so yes, I graduated in 2012. So yes. This depends also with your personal experience. So as long as the time goes by, you will also get better at different techniques and will do them more and more confidently. Yes.
And what do you think of the health dental protocols in Holland?
Yeah, I actually think that they're really accurate. They're actually really good. They follow guidelines. Most of the countries have guidelines or protocols to follow by. And what we see in Holland is that they are quite easy to accomplish actually, and it's also for the better working of the whole system, the whole treatment, the whole practice. Yeah. So I think they're really good, and actually. We try to follow them so strictly as possible, exactly, to ensure a better quality in the service we pay to our patients.
Yeah, and is it also a bit the same in Portugal? The protocols?
Yes, actually, it's a little bit the same. All the protocols may vary a little bit in simple things, but because it's like a scientific environment we're talking about, they really look alike everything. So what you have to do and which order you do it. It's the disinfection, which is really now it's a really everybody talks about disinfection and cross-infection. For instance, when a patient comes in and the other one comes out, and there's bacteria, and then at what level can we prevent that the bacteria from one patient goes to the other? It's a really important field, and the protocols help us in that area. Yeah.
Okay. You also told me before that you are studying to become a brace or
an orthodontist.
Bracket dentist. Yes. Is there a big amount of people who study this profession in Portugal?
Yes. Just to correct you a little bit, what I do, and it's also different than in Portugal. I'm following a course to be able to put braces on children. Or an adult as well. But I will not be an orthodontist, and that's a big difference that you have here. In Portugal as well, every dentist can place brackets, and if you do it correctly or not, well, that's a big issue. So, in my opinion, you should be educated to do that kind of work, because it's not what we generally learn in college. Like everything, you get the basis and then you develop your knowledge with practice. Yeah. Well, in college, what happened is that we got the basics of orthodontics, but because
all the dentists,
all the dentists have the basis of orthodontics, but there's much more to it than just the basic stuff. So only with the base, in my opinion, it's not you're not able to fulfill your treatment plan as an orthodontist correctly.
Yeah.
So you do have after college to do like a course or a really full education course. Yes. What I do think it works different here than in Portugal, for instance. If you work as an orthodontist here, you cannot, and if you have the master's degree, you cannot do other simple things. You cannot practice dentistry.
Okay.
So you will do an orthodontist course, or you'll do dentistry. Okay. So that's why I am taking a course, because I actually like the dentistry part very much, and I would also like to complement it by doing orthodontics. And if I study the 4-year full-time course to do the orthodontics, then I won't be able to do this.
Yeah, so just does this or that. Yeah.
Yes, exactly. Which I think it's also okay, because then you can, you know how many people you can in the country. Then you make sure that you don't have too many orthodontists or too many dentists.
Yeah.
Because if there are too many, then it's like what happened in Portugal. If there are too many dentists, then you don't have work for all of them. So what happens? Things have to be balanced a little bit to make sure everything works smoothly. Let me say it that way. So what I'm doing right now, I'm just taking a course to see if I like it. And if I do like it, and if I think, oh, this is what I'm going to do the rest of my life, then I will apply for the course to be an orthodontist and only do orthodontist here in the Netherlands. That's how it goes.
So you will see if you like it.
I will see how it goes. So,
but maybe because of the cost in Portugal, I don't think very much people have money for a bracelet.
That's true. A lot of people don't, and especially a lot of children don't do it as well, because here in the Netherlands you will get a help from the insurance actually.
Yeah. You have to take an extra insurance for bracelets.
Yeah, exactly. If you do that, you pay a little bit more per month in your fee. But you will have, it depends on which insurance you have, but you will have help from the insurance company to pay for the braces. Yeah. And then it makes possible again for people with not that much money to pay for the braces for their children. Yeah. In Portugal, once again, it doesn't work like that. So yes, a lot of children need it, but don't have it.
And then they don't do nothing. They can't do anything.
They can't do anything about it.
And with older people in the care houses, what will they do with that? They
they just take them out, and if they don't have any money to put a new denture, then it doesn't happen. Yes.
Okay.
Yeah.
Well, I think I have enough information about the difference in healthcare, also compared to Portugal.
Yes.
So I really want to thank you for your time to let me interview you.
Yeah, thank you very much for this opportunity, and I wish you all success in your life.
Okay, thank you.